In today's health alert, the world is seeing a continued reduction in the number of children vaccinated against various illnesses. A new report raises concerns about the immunization gap that is leaving millions of children unvaccinated. We reached out to the Michigan Department of Health and Human Services to find out what immunization rates look like here. So joining us now, our Chief Health Editor, Dr. Partha Nandi, examining those findings and what can be done to bring those numbers up and, quite frankly, bring confidence up.
It's concerning to me, right?
Yeah.
Childhood vaccination rates declined around the world during the pandemic. Now here we are, right? 4 years later, and the numbers, Glenda, still have not recovered, unfortunately. The latest data came out today from the World Health Organization and UNICEF. The report measured vaccination rates in 185 countries associated with 14 diseases. It used a third dose of diphtheria, tetanus, and pertussis vaccine known as DTP3 as the global marker for immunization coverage. And here's what the data showed, that DTP3 coverage was 84% last year, as well as in 2022. However, that's below the 86% recorded in 2019. That's concerning to me. Here in the U.S., 92% of children were vaccinated last year against measles, mumps, and rubella by age 2. However, that's below the federal target of 95%. How about in Michigan? The health department here just reported a case of measles in Macomb County, and that's the 6th case so far this year. So all kinds of concerning trends that we don't want to see.
So tell us what's happening in Michigan, and do we know what's driving this stagnant rate here?
So important, right? So several experts point to several reasons why the global decline in vaccinations are occurring, Glenda, including disruptions in healthcare services, vaccine hesitancy, that's a big one, and a lack of access to health services. The report also found that half of the unvaccinated kids last year lived in countries experiencing conflict and vulnerability like Ukraine and the Middle East. Again, very concerning. Here in Michigan, we've also seen a decline in vaccination rates over the past 4 years. According to the Michigan Department of Health and Human Services, the state's immunization coverage rate for 19 to 35-month-old was 73.1% in 2020. As of this past March, guess what? The number has now dropped to 66.5%. Again, not good news. So here are some of the steps the state is taking to increase the vaccination rates. Number one, improving equitable access to immunizations for everyone. Secondly, engaging non-traditional vaccine providers like pharmacies, dental offices, and school clinics. That's an important one. And next, expanding outreach to communities to improve vaccine confidence. And finally, hosting meetings to share new and promising practices. So there's still a lot of work to be done, Glenda, to protect our most at-risk children and to help prevent future outbreaks, epidemics, and potential pandemics. But, for people who are watching and listening, you can't listen to all that stuff on social media and TikTok and the like. You got to talk to your doctor and say, hey, is this vaccine going to be right for my kids? And follow those guidelines. Simple things you can do to really get educated from the right folks.
That sounds good, Dad. Thank you so much.
Hey, my pleasure. Thank you.
Appreciate it. If you have a health question for the good doctor, you can email him, Dr. Nandi, at askdrnandi.com, or send it to us on Facebook or Twitter. We'll get it right to him.